Hello, my name is Tori McAdams. I am a third-year occupational therapy doctorate student here at the University of Toledo. Today I'm going to be providing information on sensory processing. This presentation is geared towards the fundamental aspects of sensory processing and how it can help you as a speech therapist in the clinic. I do have experience with sensory processing from having a 12-week Level 2 all-hands-on fieldwork placement at an outpatient pediatric clinic. Majority of my caseload at my fieldwork placement required some kind of sensory processing implementation into the sessions. I also had the opportunity to co-treat and collaborate with the speech therapist while at my placement. This included implementing sensory processing while we could co-treated together or educating them on what sensory input they could provide as they were providing therapy alone. Therefore, many of my examples in this PowerPoint will come from my Level 2 fieldwork experience. First, I'm going to go over the body's sensory systems. Our bodies have a total of 8 senses. On the slide, you'll see that I provided both the common terms and medical terms for the senses. I provided medical terms as it may help you when reading or writing documentation in the clinic. The commonly known sensory systems are sight, hearing, touch, smell, and taste. The 3 other sensations that are not as commonly known are vestibular, proprioception, and interoception. The vestibular system processes movement. So if you're in your car and you close your eyes, your body can tell if you're moving forward or backwards. This is because your vestibular system is letting your body know when it's moving. Swings are commonly used in a clinical setting to activate the patient's vestibular system. Proprioception. So proprioception is information from the body's joints and muscles. If you close your eyes and hold your hand in the air, you can tell right where your hand is without having to look at it, because those receptors in your muscles and joints are informing your brain where your hand is. There are many ways to target the proprioceptive system in the clinic, but some examples are through jumping on a trampoline, animal walks, or propelling yourself on a platform scooter. Lastly is interoception. This is the ability to identify internal body sensations. For example, you can identify when you're hungry because you can feel that your stomach is empty. Or you can tell that you're anxious because you can feel your heart rate increase. All the sensations that you perceive are subjective. Everyone experiences sensations differently. What one person likes, another person may dislike. For example, some people love giving hugs, where some people try to avoid hugs. Some people love roller coasters, especially the ones that go upside down and really fast. Some people hate roller coasters. Some people love all different kinds of foods, all the spices, and are willing to try new things, where some people are more selective and limited in what they will eat. Some people can listen to music and work, and some people need to be completely silent for them to be productive. Some people love environments that have bright and multiple colors, and some individuals may create an environment that only uses a few colors with low tones. What sensations a person enjoys or dislikes leads to different sensory processing patterns. Dr. Whitney Dunn, which is an occupational therapist, created the sensory processing model. She found that there are different ways that an individual's central nervous system processes sensory information. As stated in the last slide, some people may really like one sensation and it can help them relax, whereas someone could receive that same sensation and cause them discomfort. Therefore, Dr. Dunn identified that there are 2 factors to consider for processing sensations. One factor is the amount of sensory input it takes for an individual to identify that the sensation is there. This is known as threshold. The second factor is how the person reacts in the environment in regards to sensory input, which is known as self-regulation. This slide is on the sensory processing factor that involves thresholds. There are 2 different thresholds in receiving sensory input. An individual's threshold can be low or their threshold can be high. With a low threshold, it does not take much input for the individual to notice that the sensation is there. With a high threshold, it takes a lot more sensory input for the person to notice that the sensation is there. So I have 2 buckets here. One is a low threshold and a small one, and this big one will be the high threshold. I also have colorful pom-poms to to symbolize sensations. So things like different textures, movement, joint pressure. And so a person with a low threshold, so the small bucket, will notice that a sensation is there very easily. For example, they may be aware of something as simple as a tag on the back of their shirt, or their sock is simply slightly out of place, or they may be hearing buzzing from a light. It doesn't take a lot of input to fill up their bucket, meaning that they feel that sensation very, very quickly. Whereas individuals with a high threshold are opposite. It takes them a lot longer to notice that a sensation is there. So if we go over those same sensations, such as the tag of a shirt, it's not going to fill up their bucket very easily. Or that their sock is out of place, or that there's a noise from a light. They're not going to be aware of it because it's not hitting their threshold. So that way they just don't know that sensation is there until it hits their threshold. So think about a sensory sensation that you absolutely cannot stand. Even if it's a little bit present, you get really quickly irritated. For me, it's nails on the chalkboard. As soon as that sound is produced, I want to stop reaching my threshold very, very quickly. So as soon as the sound is produced, it's hitting my threshold and I want it to stop. I notice it's there and I want it to be done with. And then now think of an example of a sensation that you really like. So I really like spicy foods. I add spices to all of my foods. And if I don't have it, if my food isn't spicy, I usually just think it's kind of dull and plain. So I just continue to add the spices until it hits my threshold and it fills up my bucket completely. So I just would keep on adding it until it hits that threshold. Okay, moving on to the second factor, which we would need to consider when processing sensations, which is self-regulation strategies. There are two ways individuals self-regulate in regards to sensory input, which is either having an active strategy or a passive strategy. With an active strategy, individuals perform actions to either receive sensory input or avoid sensory input. An active strategy would be going back to the spicy food example. I actively add spices until I get that spicy taste I'm looking for. With a passive self-regulation strategy, an individual will remain in their environment and let the sensory input occur without doing anything. So with the chalkboard reference, if I would remain in the room and continue to take in that sensory input of that sound, I would quickly become overwhelmed and irritated. So a passive strategy would be just remaining in your environment and not doing anything to stop whatever sensation is occurring. Since there are two thresholds and two different self-regulation strategies, we end up with 4 different sensory patterns. The patterns include seeker, bystander, avoider, and sensor. I'll go into each pattern and explain more about them in the upcoming slides. But if you ever heard someone in the clinic say, oh, he is definitely a seeker, or yeah, she's an avoider, this is exactly what they're talking about. The first one I will talk about is sensory seekers. Seekers have a high threshold, meaning it takes a lot of sensory input for them to actually feel it, and they have an active self-regulation pattern, meaning they manipulate their environment so that they can receive the sensory input until it reaches their high threshold, like the example I gave about spicy food. Seekers will not notice a sensation unless it hits their threshold, and they keep performing actions until the sensory input hits their threshold and that they notice it is there. So they actively search for sensations. So things like tapping your foot, wiggling and shifting in your seat, touching anything out in front of you, all the different textures and all the toys, smelling things like markers, chewing on the end of your pen or other non-edible items, or constantly needing to walk around the room, just not being able to sit in your seat. Seekers can have difficulty paying attention because they're constantly seeking out sensory input. So instead of sitting calmly in your chair during a therapy session, they may be trying to get up, walk around, and become easily distracted with all the other toys in the room. The next sensory processing pattern we'll talk about is bystander. Bystanders have a high threshold again, like the seekers, but they have a passive self-regulation strategy. So with a high threshold, it takes a lot more sensory input for them to notice a sensation is there. but they have a passive regulation strategy, meaning they don't do anything to go try to find those sensations. So with the bystander, sensations can happen all around them and they may have no idea until it hits their threshold. So for example, when cleaning, they may commonly miss spots that others notice because their threshold for receiving that visual sensory input is so high that they simply just don't notice that it's there. Dr. Dunn explained a bystander by using one of her friends as an example. Her friend was a professor, and during the middle of the lecture, one of his students noticed that the professor was wearing two different types of shoes. One had a pointed toe, and one had a round toe. Typically, someone would be able to feel the difference between the shoes, but this professor had absolutely no idea. Because the professor had such a high threshold for tactile input, his body did not register the differences that the shoes caused. Some other examples that I experienced in the clinic were children who would come in with their shirt either like inside out or backwards. Typically, especially if there's writing on the inside, you would notice that it's against your skin, but they had no idea. They didn't realize that they would have food all over their face, so they would come in from their afternoon session with lunch all over their face. Or they just weren't as aware in their environment, so they would constantly like bump into different items and equipment in the room. These individuals are often known as easygoing because they aren't bothered by a lot of sensations. And these individuals can be a safety risk because they don't notice the sensations that may alert the individual that harm is near. Next up is avoiders. So avoiders have a low threshold, so we're switching to the small bucket now, and an active self-regulation strategy, meaning they can't take a lot of sensory input, and once it hits their threshold, they do whatever they can to avoid receiving more sensory input. So sensations like a crowded room, bright lights, weird textures become very overwhelming for them. So their bucket easily gets filled. So they have an active strategy. So they do whatever they can to remove those sensations. So things like just walking out of the room, plugging their ears, avoiding crowded places. So looking up when places are most crowded, like a grocery store, and choosing a different time to go. They do whatever they can to empty their bucket so that their threshold isn't being hit. And then last is sensors. So sensors, again, have a low threshold, like the avoiders, but they have a passive self-regulation strategy. So almost like the avoiders, they notice sensations very, very easily and quickly, but they don't do anything to make the sensation stop. So going back to the sensations such as bright lights, crowded places, and noisy environments, their buckets are going to continue to get filled because they aren't doing anything to stop the sensations. So eventually their buckets are going to overfill and they're going to become overwhelmed and it can lead them to have meltdowns. These individuals are often distracted by noises. They have trouble working in noisy environments, notice all the small things that a lot of people don't notice. Sensors may be known as more picky because they just simply can't handle a lot of sensations. So everyone has a sensory processing pattern. So everyone fits somewhere within a seeker, bystander, avoider, or sensor. Sensory patterns can differ depending on the sensory system. So someone can be a tactile seeker, but a vestibular avoider. For example, I'm a tactile and vestibular seeker. When I go to stores, I have to touch all the different textures and clothing material. And I absolutely love roller coasters. I love the ones that go upside down super fast, all of that. But I am an auditory sensor. I easily become annoyed with the smallest sounds. I can't stand things like clocks ticking or people humming. I easily get overwhelmed. However, your certain pattern may not remain consistent over time. There are different factors, such as psychological or emotional state, that can affect your threshold. So if you are already stressed out, your threshold may be a lot lower than normal. So if you're stressed out about a test and you're an auditory sensor, the littlest noise that you normally can handle may make you irritated. Understanding your own sensory patterns will make your days flow a lot better because you'll understand what you need to do to remain at a satisfied level so that you can either hit your high threshold and get all the sensations that you need, or make sure you don't go over your low threshold and learn how to avoid certain sensations and plan out your day better. So sometimes take a minute and think about your own sensory processing patterns for each sensation. Also, knowing your patient's sensory patterns can be beneficial. You can set up a sensory environment that best matches their sensory processing pattern that allow your patient to be best attentive during your sessions. It's also important to note that behaviors can be learned. So even if the child is a seeker, they can still learn to sit and be quiet during class. So just because you have a certain sensory processing pattern doesn't exempt you from any of the behaviors that you perform. So, since everybody experiences sensory processing patterns, when does it become a problem? This is where sensory processing disorders, also known as SPD, come in. As of right now, SPD is not an actual diagnosis. They're working towards making SPD an official diagnosis. However, they're still fine-tuning the research in it to make sure there's no other underlying issues. There are two components of SPD, which include sensory motor disorder and sensory modulation disorder. Sensory motor disorder is when individuals have difficulty with coordination and balance. These individuals are often clumsy, have poor posture, and low muscle tone. Sensory modulation disorder, which is what we're going to be talking about for the rest of the presentation, is having difficulty organizing and interpreting sensory information that lead to disruptions in class that they need to, or disruptions in tasks that they need to do. In regards to sensory processing patterns that we just discussed, individuals with SMD experience sensory input at a more intense level than a typical person, which makes it hard for them to complete what they need to do throughout their day. As I'm creating my capstone project, I found that there are very high correlation with sensory processing disorder and developmental disability. So it's very likely that you'll experience a patient with sensory processing disorder in your caseload. So some signs of sensory modulation disorder are being too responsive to usual tolerable sensations, craving and seeking out sensory input, lacking awareness in their environment, and inconsistent with sensory responses. So how they may respond one day to a sensation may not be how they respond that next day to that same sensation. All these signs lead to disruptions in whatever task that they're trying to complete. So how can we help individuals with sensory modulation disorder? The goal is to help the child become more functional and productive within their environment. One way to achieve this goal is to adjust the sensory environment. You can add or take away sensations in their environment to help meet their needs. Occupational therapy can also provide interventions to change the individual's thresholds. So back to the buckets, instead of having a really low threshold or a really big threshold, we work with the individual and adjust their threshold level to be somewhere in the middle so that they can tolerate sensations more throughout their day and be more functional in their day. So on this slide, you'll see Yerkes and Dodson's law displayed in the graph. This law is in regards to level of alertness. On the left, there are principles such as sleep and boredom, and then on the right, you have panic, anxiety, and stress. In the middle is that optimal level, which is also displayed with that green outline. This is going to be called the green zone, and I will call it the green zone throughout the rest of the presentation. The green zone is where an individual should be to be most productive. Productive meaning being functional in whatever task they are performing, such as completing classwork, playing with a peer, socializing, or even completing chores. So think about productive behaviors that you look for during your speech therapy sessions. So things such as sitting quietly in your seat, making eye contact, being an active participant in whatever game you're playing. This is all being in that green zone. During your speech therapy sessions, you want your patient to be in that green zone so that they'll be most willing to participate to help them achieve their goals. Many things can alter an individual's alertness level, with sensory input being one of them. So how tired a kid is or how anxious a kid is can be altered by the sensory input that you implement in your sessions. Now I want you to picture a session where the patient was not in their green productive zone. So where their alertness level was way too low or way too high. Too low would be not being interested in participating in the session, too tired or too bored. Or too high would be too overwhelmed or excited to be productive. Being irritated, on edge, moving around a lot, being too happy or appearing anxious or stressed. Either way of the bell curve, it is really hard for the kiddo to focus and be productive. Therefore, there are specific sensory techniques you can add to your sessions to help them get into that green zone, whether you are on the lethargic end or the overstimulated end. If your patient comes into therapy session and appears lethargic or sluggish, you can add sensory input to increase their alertness level to get them to that green zone, to be more productive during their session. One strategy is to use fast, rapid, unexpected movements. This is where swings are beneficial. If the child is sluggish or not very alert, putting them on the swing and performing fast and rapid movements at the beginning of the session will increase their alertness level. I did this in the clinic all the time. If the patient appeared tired or not really interested in the session, the first thing I would have them do is get on the swing and produce rapid movements, almost like a roller coaster, shaking and all that good stuff. And they would have the biggest smile on their face and they were ready to participate in the rest of the session. Some other ways to produce rapid and fast movements is doing things like an obstacle course, getting on a platform scooter, having them scoot around, doing some hopscotch. Just be creative. Other methods are using various textures such as Play-Doh, bubbles, finger paint to help them increase their engagement in the session. Use the auditory system by using upbeat music, auditory toys. Also use bright lights and colors. Toys that light up are perfect. And even use strong scents and taste if possible. Going back to the sensory patterns, individuals who have a high threshold tend to fall into this category, which are seekers and bystanders. So for seekers, again, these are the ones with a high threshold. They need a lot more sensory input to fill their bucket. For seekers, adding in this type of sensory input can help them receive the needed input that they crave, which can lead them to be able to focus better during their sessions because they don't have to search for their sensations on their own. So if you provide it during your session, they don't have to sit there and try to seek out their sensations on their own, which would be disruptive to your therapy session. For bystanders, adding in multiple sensations can help reach their threshold. So once their threshold is met, they can notice those sensations more and they can become more alert. I noticed that my bystanders would often appear bored by just adding in some more sensations, helped hit their threshold, and then made the session way more fun for both me as a clinician and them as a patient. On the other hand, if the child appears to be excited or stressed, the therapist can adjust the environment to be more calming. First, provide expected and predictable sensations. Use slow and patterned movements, going back and forth. We call it a linear movement. And going back and forth is calming, almost like a rocking chair, and it can help lower their overstimulated behaviors. Use quiet environments. Talk in a soft tone. Avoid loud toys and music. Often, if I knew the kid was often overstimulated, I would come in and I'd whisper really, really lightly with them, and it set the mood for the rest of the sessions. They would often whisper back, and it was just more calming. If the facility has a dimmer, dim the lights. Again, adding in that calming mood for the rest of the session. This is also where it's beneficial to use deep pressure, such as weighted blankets. I do want to note that a weighted blanket should be no more than 10% of the child's body weight for safety purposes. But deep pressure helps provide a sense of organization and calmness. So by providing them that weighted blanket, they can kind of calm down and be able to focus more in your sessions. Also try to avoid bright colors. Don't try to avoid the light up toys and try to avoid strong smelling scents. Again, going back to the sensory processing patterns, individuals with low thresholds tend to fall in this category, such as avoiders and sensors. So for both avoiders and sensors, trying limiting the amount of sensory input in their environment will help prevent them from filling up their bucket too fast and becoming too overwhelmed. When working with an individual, it is very important to watch their body language throughout the session. If they seem sluggish at first and you add sensory input to increase their alertness level, continue to watch their body language to know if you need to add more sensory input or if you need to back off a little bit. Because what can happen is the child can easily shift from being on the too overstimulated side to the lethargic side, or vice versa. I had a patient who would switch from lethargic to overstimulated very fast. So the speech therapist and I had to constantly watch his body language and switch up the kind of sensory stimulation we were providing to help him remain in his green zone. So he would often come in overstimulated. So we would first provide calming techniques, so dim the lights, use a weighted blanket, but we had to watch him very closely because as soon as he showed any sign of being on the lethargic end, he would instantly fall asleep. So we had to watch him very, very closely. And if we saw that he was kind of getting low on that end, we would all of a sudden add fast, rapid movements. He was in a wheelchair, so we would push him around the gym and use upbeat toys. And then once he was alert, we would have to bring him back down, trying to get him in that green zone whenever possible. It took a little bit of time to figure out his green zone. It was very narrow, so it took a couple of sessions, but we eventually figured it out, and we just had to continue adding that kind of sensory input throughout the remainder of the sessions. Sensory diets. So sensory diets are strategies that are implemented throughout a child's day to help them meet their sensory needs, to allow them to become more productive. So basically, it's a way to adjust their sensory input in the child's environment to help them get in that green zone. Sensory strategies can either be used for before the task, during the task, or after the task. These strategies will be used to either increase alertness when lethargic, promote calmness when too overstimulated, or promote organization when needing to focus on a task. Again, the goal of a sensory diet is to help the child become engaged in the task. Watching the child's body language will help you know what strategies you need to use to help the child's current state. So again, if the child appears too lethargic, add rapid movements. If the child is too overstimulated, dim the lights, use a softer tone when speaking. Make sure you stick with routines. Children do best routines. So if the child is used to getting on the swing right away when they arrive to a session, stick with that routine. Switching up a routine without warning can lead to anxiousness and uncertainty. Also be very clear with transitions. Let the child know when you're done, you're going to stop the sensory activity. Going back to the swing, saying we have 10 more swings, then all done. And then count down each swing and then being done when you say done so that the child knows what to expect. A visual schedule may also be helpful so the child, again, knows what to expect. Do not use sensory strategies as a reward. For example, swings are fun, so you would think it'd be common to use a swing as a reward. So I commonly hear, if you're good throughout the session, we can swing at the end. However, having a child swing at the beginning or during the session can lead to increased focus and participation. So if you wait and use the swing as a reward at the end, you're losing all the benefits that the swing could bring you during your session. Use what is interesting and motivational to the child. If the child enjoys animals, tell them to do an animal walk slow like a turtle or fast like a rabbit if you're trying to get them more engaged. If the child shows signs of being a tactile seeker, use activities that involve Play-Doh and finger paint while achieving your speech therapy goals to help them become engaged. This is where it's important to know the child's sensory pattern, because if a child is a seeker or bystander, they may love that tactile input, and it may help them become more engaged in the session. But if they're a avoider or a sensor, they may not like that sensation of finger paint on their hands, and it can lead to becoming overwhelmed, distressed, and could possibly ruin your entire session from then on. Overall, a sensory diet is to help a child maintain in the green zone. So maintaining in the green zone for a longer time period is very therapeutic. The longer the child stays in that green zone, the easier the child can get back to that green zone. And eventually this can help the child get to the green zone on their own, which can help them be more functional in their day-to-day activities. So how can sensory input help you in the clinical setting? There is an assessment that is called the sensory profile. The sensory profile is a questionnaire that a child's caregiver fills out. The answers allow you to see where the child is in relation to the 4 sensory processing patterns. At my last fieldwork placement, both the OT and the speech therapist administered the sensory profile. Many times the speech therapist would use it to understand the child's sensory needs for their sessions, and if the scores were out of the norm, they would refer the patient to see the OT. If you do use the sensory profile and a child scores out of the norm, I would recommend that you refer the patient to see an OT, since we are trained with sensory processing and helping adjust that threshold so that they can be more functional in the future. It is also important to discuss a child's sensory diet with an interdisciplinary team. Find out what is beneficial to the child and what you should avoid. So going back to finger paint, you may not know the child does not like messy play. So messy play being things like finger paint, foam, weird textures. If you use it in your session and the child doesn't like it, it can lead to some distrust between you and the client. Therefore, double checking with the OT to see if you're seeing the same patient to see what would be beneficial, what could help avoid those situations. Co-treatments are also very beneficial for sensory processing. In my last fieldwork placement, I would co-treat with a speech therapist daily. We would work together to help the child stay in that green zone while addressing all of our other goals. Also, do some research on what is beneficial. In a clinical setting, you may hear the term heavy work. Heavy work is providing activities that promote stretching or compression of the joints or muscles. So activities such as pushing a cart full of weighted balls, performing animal walks, propelling yourself on a scooter. Those are all known as heavy work. In my last fieldwork placement, speech therapists use heavy work all the time to help their patients become engaged in their session. If you research heavy work ideas, you can find a lot of unique activities to use in your therapy sessions. And then document. Document what sensory input you provide or notice that works with the patient. Other disciplines can read your documentation and it can better help the whole disciplinary team. Okay, so to end this presentation, I'm going to provide a case study from my fieldwork experience. This will help you better understand why it's important to read body language and how adding sensory input can really help your session. So the patient's diagnosis was drug exposure in utero, which led to some developmental delay and some sensory processing difficulties. This patient was also being co-treated by me as an OT and the speech therapist. This was one of my first clients I had as a fieldwork student. So I've learned about sensory processing before in the classroom setting, but I never had a hands-on experience with sensory processing disorders. This is also one of my first patients, so I was really hyper-focused on the activity that we were doing and wasn't really worried about any external factors or like body language. So the first time working with a patient, I tried to do a tabletop task with sitting in a standard chair. The child was really struggling with the task. She was becoming easily distracted. The session just was not going well. My supervisor stopped me and told me to take a minute and watch the child's body language. The patient was shifting in her seat, kicking her legs, reaching out to touch different items in front of her, and constantly looking around the room. I then realized the patient was a sensory seeker and was not getting the sensory input that she needed, which led to her not being able to focus, meaning she wasn't in her green zone. Also, another thing with a standard chair, it was too high for her. So she was constantly kicking her feet, trying to find something for her feet to have that input, a sensory input. So providing a small box would have been really beneficial in this case for her to put her feet on, or a smaller chair. So the next session, I plan to provide a lot of sensory stimulation at the beginning and throughout the session. So when I greeted the patient, I use a really upbeat, excited tone of voice. I had her do really fast animal walks like a bunny. I had her sit on the swing, use rapid movements. And although I added the sensory input to meet her threshold, the session was a disaster. She was way too overstimulated and was not organized at all. I actually created a safety risk because she was so overstimulated, she had no control of her body and was really close into running into the walls and other equipment around the room. Me or the speech therapist were not able to complete any goals that day. The third time I saw the patient, I adjusted my plan. I used a quiet, low-toned voice with her throughout the session, did animal walks with her, but used the analogy slow like a turtle. And she kept trying to speed up. I was like, whoa, wait, we're being a turtle. Remember, go really, really slow. And she would do it. And I also added some other sensations like manipulatives for her to play with. So when the speech therapist was working with her, she had cards and the patient was constantly reaching out to grab the cards because she needed to touch something. So I just gave her some Play-Doh or even like cotton balls like this for her to kind of play with, helped her sit there and be engaged. I also had her sit on the mat instead of a standard chair because there's all these different textures that she was receiving from the mat that it was different from a chair, so she was able to focus a little bit better. I adjusted the environment just enough to add just enough sensory input to get her to that green zone to have her be productive and that throughout that session. So in this case study, it shows that it's important to read the patient's body language and to figure out what works best for them so that you can help them achieve their goals. So if you have a patient that's wiggling around and not being productive during your session, these are some ways you can implement some sensory strategies that you can implement in your sessions to help your patient sit there calmly and listen to whatever you're trying to get them to do, and it can help you achieve your goals better. Here's my references. Everything I use is evidence-based, so if you want to double check or look more into sensory processing, feel free to. Dr. Dunn, again, is the person who came up with sensory processing, so I have a lot of articles from her. And then the Living Sensational book by Dr. Winnie Dunn is also really good. Kind of gives you a foundation of what sensations are and how us as humans process sensations in our daily life. So this is my presentation. If you have any questions, please feel free to reach out to me. I'll provide my email in the YouTube link. But other than that, thank you for paying attention during my presentation.